Welcome to Clyde Health's Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Dr. Victor Filadora, the president of Great Lakes Cancer Care of Western New York. Today, we'll be discussing oncology, cancer care, as well as the Great Lakes Cancer Care Initiative here in Western New York. I'm Mike Hughes, and this is Medically Speaking. Dr. Filadora, welcome. Thank you for joining us today.
Thank you.
You're heading up Great Lakes Cancer Care. There's been an awful lot of buzz in the community. Television spots, ads that you see, billboards, things like that. So if you can, tell us a little bit about the initiative and what that entails.
Yeah. Well, it's a very exciting initiative for Western New York. I like to think of it as an academic community cancer center. And it's really made up of four things. It is a collaborative team of about 8 healthcare partners that's come together in Western New York to really elevate the care of cancer.
Sure.
They are doing this in a collaborative way, which is really important. If you're a cancer patient, you want people in different disciplines talking about your case, looking at the best guidelines, trying to figure out really the best way to treat your specific kind of cancer. And this program has enabled that to happen. And they do this in a compassionate way that really focuses on your specific situation in life, because oftentimes you can have different treatments that have the same outcomes, similar outcomes. But life circumstances are different for everybody.
Sure.
So we want to do this in a really compassionate way, and then in a way that's convenient for you. Because we have so many partners, we have over 20 locations where our care can be delivered throughout Western New York.
Right. So this isn't a new initiative per se in terms of, we're starting up a new service line or new business line. Really, it's just the new part of it is just we're organized under one umbrella, under one corporate name, whether in the business world like a Procter & Gamble situation, where they're a family of companies. So it's just really the organization of cancer care.
What many people don't know is that Kaleida already takes care of over 1/3 of cancer in Western New York.
Sure.
And so this really is an effort to really coordinate that care, elevate the outcomes, and really help people in a more collaborative way.
Right. So talk more about that collaboration. Why is that so important? There are multiple entities in the community, 3 different hospital systems who provide oncologic care. But why is this collaboration so important?
I think for a number of reasons. First of all, it pushes care out into the community where patients live. And that's really important, because as being good stewards of healthcare dollars, you want to do care in a more cost-effective environment. Oftentimes, bricks and mortar and coming downtown was what we thought was important. But now really, as partners, we want to deliver that care to where a patient lives. The other things this does is breaks down silos. With these 8 different partners, this collaboration allows them to work together more efficiently and really care for you in a better way. And they do that not only through talking in these multidisciplinary conferences where they meet, but also through a program called Nurse Navigation. And what this navigation program does is it partners a nurse with a patient's care. Okay. And they really take that patient through their care continuum from the time that they have a diagnosis, through their treatment and through recovery and survivorship, and really kind of navigates their care so that the ball's not dropped, so they don't miss appointments, so they don't forget medicines or treatments or things of that nature. And all of this does, it really helps to decrease cost and improve quality and outcome.
So if you can give us an example, a patient comes through the emergency room, whether it's at Suburban or Buffalo General, walk us through that process in terms of they end up with a cancer diagnosis and how those pieces all fit together in terms of the physicians within the hospital and then their primary care, oncologic care. So talk a little bit more about how those pieces all fit together.
Sure. So I think the system is fortunate in these 8 partners. And what this partnership allows is really the ball not to be dropped from your primary care doctor. So you come into the emergency room, you have a diagnosis. What we're building throughout the system are centers of excellence. And depending on your diagnosis will kind of really depend where you end up. So for example, we all know that ECMC has a phenomenal head and neck oncology program. So if you were to come through the system, no matter what emergency room or primary care doctor you might have, that's going to be our center of excellence. So if you have head and neck cancer, that's where you go for your treatment. You'd be paired up with a nurse navigator from the time of the emergency room, your primary care doctor. They'd make the appointments. They'd guide you through the appointments. And then once your treatment is decided upon, they'd make sure that the proper things were scheduled, whether they be scans, whether they be surgery, whether they be follow-up. And then, as people know, there's a lot of side effects with cancer treatments. And so the other real big benefit that this system has is the plethora of specialists throughout the system.
Right.
So if you develop some kind of a medical condition, whether it be diabetes or a physical therapy issue or whatever it is, there's specialists everywhere that really can look at your care, take a look at your situation, and make sure that your care is optimized.
Sure. So you mentioned the partners. There's Kaleida, ECMC, the university, general physicians, West New York Urology, Cancer Care West New York. I mean, the list goes on, which is a benefit to the community and the strength of, I think, this initiative. So if you are a patient and you pull up to your physician office and it's general physician's PC, or you end up going to a specialist at West New York Urology, you're not going to see the name on the back or on the side of the building. It's going to be these in particular organizations, correct?
It's going to be, yes, and then it's also, I think, going to be a combination. So, you know, these are all partners, so they're all a partner of Great Lakes Oncology. And these 8 individual entities really have established themselves in their own right. If you take a look at Winsong, they have great breast surgeons, they have a great interventional program, they have great diagnostics, right? So when you go to Winsong, you know you're going to Winsong, but they're a partner. Right. So you'll see their brand, you'll see their name, but you'll also see the partner name of Great Lakes Oncology there together.
Sure. And this initiative really seems to be addressing a need or a hole in the market when it comes to cancer care, from the sense of diagnosis to, you know, final treatment or ending treatment. Talk a little bit about, you know, that need that exists in the community.
So I think the need in the community is to avoid really duplication of resources and really rapid, proper diagnosis and effective treatment. And so what we really want to do is pool these resources so you don't get duplicated tests in different areas. And once you get a diagnosis, what we're trying to do across the organizations is really create a standard so that everybody follows that standard. So no matter where you get treated, the treatment options that are presented to you are NCCN guideline standards, our best practice guideline standards, so that they can be looked at in multidisciplinary conferences. People can really examine special cases and make sure that they're getting the proper care that's needed. And without this collaboration, there hasn't really been that multidisciplinary team approach to patient care.
Go back to the nurse navigator that you talked about. That seems like it's somewhat new or a newer type of idea, but it really seems to be something that's designed for peace of mind, or that person that is with you every step of the way as you go through that journey of dealing with a cancer diagnosis.
I think that's one of the most important things in a great cancer program, because you can have the best treatment laid out for you, but if you don't understand the treatment, and whether that be financial obligations, whether that be appointments that have to be made, or scans that have to be done, or medications that need to be taken, your outcome will be affected because you've missed certain things that are really key to a successful treatment. And so this is really one of the strongest navigation programs that I've seen, and that every cancer patient is paired with a nurse navigator. Right. And so throughout their treatment program, their hand will be held. So and not only do they hold that patient's hand, but they hold the caregiver's hands too, because the caregivers are going to have to understand special circumstances that they might not be aware of. Okay. And so it really is kind of the nurse works both sides of the spectrum to make sure that the patient needs are met, and then the doctor understands what's going on in the patient's life.
Unfortunately, cancer exists in healthcare, and it's something that we deal with. If I or someone else ends up with some sort of cancer diagnosis, how do I get connected to Great Lakes Cancer Care?
I think there's 2 great ways. The first is the website. So you can visit our website, and then the second way is really to call our call center phone number.
Great. Dr. Filadora, this collaboration is a great win for Western New York and for cancer care here in the community. Thanks for joining us today, giving us this update.
Thanks for having me.
I'm Mike Hughes. Thanks for joining us on Medically Speaking. We'll see you next time.